Welcome to Aging in Place Strategies and Answers with Linda Prio. Will it be possible to remain in my home as I age? Do I feel safe in my home? How do I figure out how much support I will need when my health needs start to change? What if I decide to move into a community instead? Which community will meet my needs now and in the future? Who will play a role in helping me with decision making? Do you ask yourself these same questions? Aging in Place Strategies and Answers can help you gain practical knowledge that will help you create your own Aging in Place roadmap. If you are already a care partner, a power of attorney, or in crisis mode with your Aging in Place strategy, you will learn what you need to know that you don't know. For over 20 years, I have been marketing Aging in Place services to clients and educating families and healthcare professionals in how to put aging in place strategies into place. When you utilize aging in place, you are allowed to choose where you want to live and make those decisions so that you can retain your quality of life. Welcome back to Aging in Place Strategies and Answers. As a young child, when I traveled with my parents, I frequently asked, "Are we there yet?" And when they told me we were not there yet, I always asked, "How much longer do you think it's going to take?" With the advances in navigation, you can usually see an ETA or an estimated time of arrival as soon as you pull up your navigation, put in your route, and that way you'll know about when you're going to arrive. As someone who is always on the road for business or travel, I have learned to appreciate my navigation, confirming that I have arrived at my destination. Healthcare has also been on the move away from a medical care model to a patient-centered care model, but we just aren't there yet, and I'm not sure when we will be. In today's podcast, I want you to be thinking about your answers to the following questions because that will allow you to evaluate how well your team, your healthcare team, is progressing toward a patient-centered care model. And really, it's all about you. You're the most important thing in the center of a patient-centered care model, and no one is more concerned about your health than you are. So let's start with my list of questions. As a patient, do you feel that your health team takes the time to listen to you and to learn your concerns, your fears, or your health goals? Do you feel that you're given enough information about your condition or your diagnosis to understand what is going on, what could be the cause, and what actions you can take to live with the diagnosis, or how to make lifestyle changes? Oh, we're going to be talking about lifestyle changes in greater detail in the future, so stay tuned. Does your team explain what medications are being prescribed, what they are for, and what to look for, and how long to take them? If you have medical tests ordered, as a patient, do you understand the reason tests are being ordered? What should you expect during the test? And who will communicate the information or the results of the test to you, and what the time frame will be that you should expect those results? If you have had a hospital stay, do you know and understand what the roles of the people that you met during your hospital stay had in that healthcare setting? Did you or your support system have access to the hospitalist, the care manager, or physical therapist to learn more about your diagnosis and next steps? Was your support system informed on the role they would have at discharge and post-discharge? As a patient, were your physical care needs met while you were at the hospital or during a rehab stay when you required extra assistance? Were your personal care needs, such as toileting, showering, or other personal hygiene items, taken care of promptly and efficiently while you were in the hospital or at rehab? Was the discharge process explained to you or your support system? Did you understand the post-hospital or rehab stay follow-up process with your primary care physician or specialist? Were you informed of what your insurance would pay or not pay and what your financial obligations would be? Now, I know that was a lot of questions. It was a full list, and I tried to go slowly, and I'm sure you were ticking off the answers in your head. But my educated assumption is that there were failings along the way, and many have gotten caught in poor communication and poor memory of the situation. I'm not saying that you have a poor memory, but studies have shown that 40 to 80% of the medical information patients are told during office visits is forgotten immediately, and nearly half of the information retained is retained incorrectly. My goal with any of the podcasts that I present is for you to gain knowledge. When you have knowledge, you reduce your stress and anxiety over the unknown or unanswered questions. If you do not remember anything else from today's podcast, please remember this. Do not leave your common sense at the front door of the hospital, a doctor's visit, a medical test, the pharmacy, or any other healthcare setting. It is okay to ask questions. However, being rude or disrespectful or difficult will not help in any situation. My mother always told me, you can catch more flies with honey than you can with vinegar, and I tried to remember that. Like I have said, by 2001, healthcare started shifting from a medical model of care to a patient-centered care model. The goals of a patient-centered healthcare model are to empower patients to become more active participants in their care. This model requires that physicians, technologists, and other care providers develop good communication skills and address patient needs effectively. Decades of research have demonstrated that when patient values and patient preferences are prioritized, the patient engages more in their treatments, leading to better health outcomes. Furthermore, hospitals and medical practices that implement patient-centered care report lower readmissions, fewer ER visits, and faster recovery for the patient. Please try to remember the initial questions that I asked and keep assessing if your healthcare team is learning your preferences, your values, and that your needs are being considered. If you can see that they are not there yet in a patient-centered care model, that is where you as the patient can speak up and communicate your needs. Let me give you another illustration. Here is a story I heard a couple of weeks ago. A patient was having prostate issues that hospitalized him at least 2 times. Upon follow-up with his physician, he was unable to reduce his reliance on a catheter. When he asked his doctor about next steps, the physician told him he would have to self-cath for the rest of his life. He told his physician, I absolutely refuse to live like that, and surely there is another option. I am happy to report that his physician thoughtfully prescribed another solution that was successful, and that this person has not had any hospitalizations related to his prostate issues. As a result, the patient recommends his urologist to everyone, and he sings his praises. Let's review how this interaction produced positive results for both the physician and the patient and illustrates patient-centered care. The patient listened to his physician and expressed his opinion on how he wanted to live. The physician allowed his patient to express his thoughts and concerns. The physician heard his patient and then recommended another option in treatment. The patient chose the treatment option that aligned with his choices for quality of life. The treatment the physician recommended was successful for this patient. The physician practiced good medicine, and the patient feels like he has a physician who listens to him and whom he can trust in the future. Before I end for today, I know I've given you a lot of questions to think through. I've given you a couple of illustrations, and in the next podcast, we're going to be looking more in depth at a patient-centered care model and a typical office visit with a physician. But I do want you to continue to dwell on these questions. I am not opposed to having a physician who used diagnostic tests to figure out what is actually going on and to give me ideas on treatment. But I do want to be involved in my own health care, and I do want to understand what is going on so that I can make an educated decision. And that's called informed. Informed consent is the process in which a healthcare provider educates a patient about the risks, the benefits, and alternatives of a given procedure or intervention. Now, a word from our sponsor.
Are you looking for resources on senior living? Check out guideforseniorliving.com for our free online senior resource guide to find senior housing, care, and community connections. Start searching now at guide4seniorliving.com. That's guideforseniorliving.com to find the contact information for senior housing, care, and community connections.
Now let's return to the podcast. Thank you for joining me today. Please remember that this podcast is intended as education and not advice. Don't forget to share this podcast with family, friends, or colleagues who want to learn how to age in place, but also share this with those who find themselves in crisis mode. Please go to my website, seniorsupportstrategies.com, for more information. When you subscribe to Aging in Place Strategies and Answers, you gain access to premium content and professional tips on creating your own Aging in Place roadmap. As always, I value the time you spend with me.